every program, regardless of where you go, you have to accumulate a certain amount of hours. Most of these schools are really, really good about understanding for international students what the requirements are in your domestic country for being able to graduate, meet the criteria in Canada for us, and then be able to return and successfully qualify for a domestic license as well. So we had loads of acute care kind of concept, your cardiorespiratory, musculoskeletal, neurological physiotherapy. So I worked in a ward that was primarily doing heart replacements. I worked on a ward that was doing a lot of tumor resections in the brain and a lot of spinal fusion surgeries. And a lot of joint replacements, kind of your classic stuff. But then one of the real strengths in Melbourne was that we got the expanded clinical scope. So working at the Royal Children's Hospital and working with, experimental spinal fusions and critically ill children with rare genetic conditions is not an experience I would have had in Calgary. I got to do a stint at a chronic pain hospital, and I actually came back to Calgary and did a private practice placement here and worked under another Australian trained physio that came back to Canada. And it bridged me into having my first job here as well. But the breadth was significant, and you effectively get an extra year of clinical placement there outside of your core placements, which kind of not only broadens your knowledge base and your experience base, but it just lets you get your feet wet in a whole bunch of different scenarios as your competence grows. And at the size of institutions that are available in Melbourne that aren't available anywhere else, including here in Calgary.
Yeah, well, that's fascinating. It sounds like a lot of cool stuff. What about you, Cierra, about your clinicals?
Yeah, I have to agree with Christian. You get a huge range of different clinic opportunities. Your core three are, like Christian said, cardio, neuro, and musk. So everybody has those opportunities. Practice. So it gave me a different, perspective of physio, and I guess the different ways that physio can make a big impact. That was something I wasn't really aware of. And it was kind of cool to, I think a lot of us have ventured, going into physio or medicine, and it was kind of cool to get that medical side of things. So I found that really interesting as well. And then with Christian, like the additional placements you get at the end where you get to try different fields, like they have like a women's health module, gerontology, things like that. And that actually was where I found my passion in pelvic health. So there's just so many different opportunities that I think you don't even really think of until you're in the situation.